This is your interview with Farah, and I'm here at the Health 2.0 Conference Dubai with Jim. Welcome.
Thank you.
Could you please introduce yourself and your organization?
Sure. My name is Jim Judge, and I'm a doctor in physical therapy, and my background is rehabilitation medicine. So our offices are in Chicagoland area. The company's name is called ReLive Physical Therapy, and so we're in a Chicago metropolitan area in Northwest Indiana, and we serve 12 locations.
So allow me to congratulate you for winning the Excellence in Healthcare Award. How did it feel?
Pretty good. It was really nice to feel. Again, this is a 30 plus year climb of working with a lot of great people, and there's a lot of mentors along the way, and visionary people that helped me get in the direction. And then I took those directions and those comments and spiritual words to me to make a difference in the world with healthcare.
And based on your years of experience in the healthcare industry, how do you think that this industry is changing lives at a global scale?
Well, I mean, it has changed a lot. I mean, when I started back in the day, there was no electronics. It was all handwritten notes. And so the changes for us is technology, of course. Technology is wonderful, part of what we do in a profession. So we're able to monitor patients a lot differently and get real-time data. It was before there was a lot more subjectivity into what we did, so now we can see a lot more objectivity in our patients' outcomes. So that's been a wonderful change for us, and we have adapted very well in that direction.
And how did you manage to pivot during COVID as a company? What were some techniques you guys used?
Assumingly, depends on what part of the world you are, but in my area, it was a heavy lockdown. So with a heavy lockdown, we were considered to be essential. So patients would come to us, but they were afraid to come to us.
Yeah.
So of course we had to pivot shift to doing some other things such as telephonic work, and then when patients were able to come, spread out the floor, if you will, have patients come 1 an hour, spread out so that people weren't getting infected, and security purposes. And we learned how to clean very well, of course, during that era. Accommodation of patients' needs and requirements was really big, but then that adaptation, we also were able to expand our business during that time because we were able to take advantage of the market and allow patients to be able to see in different markets. So I think it helped us in a long way. The second part of that piece is that we have adapted those same strategies after COVID. So we're using a lot more telephonic. We do one-on-one patient concentric care. So our competitors, patients are not coming as a mill. They're getting very hands-on treatment. So that kind of taught us a little bit more about making sure that patients come first. So there's a lot of learning to happen during that period, and I think we've become stronger as a company because of it.
And could you share with us maybe some of your future plans?
Well, we are working towards the wellness program. So historically in our part of the world, physical therapy, we're kind of under the American Medical Association model. So we see a lot of post-operative rehab, post-surgery, balance disorders, work-related orders. We see little children, pediatrics, I say collision injuries.
Yes.
And we see elderly with hip replacements, etc. So we feel very good about taking care of the communities we serve. Everyone comes in the door, we can help. Yeah. Because of the long-term time, I've seen thousands of patients, as have my colleagues. We are looking at patients in the U.S. that have a significant amount of problems with their actual health. So patients come to us for back issues, but they're 40 pounds overweight because they're off of work. So there's a lot of other comorbidities we are dealing with. So we feel like we were sending them out to other providers to help them, but there was no gold standard of care. They would come back with the same ailments. What we found out, and what I feel, is the patients came to us with inflammatory disorders, and that disorder was directly related to nutrition. So we feel like nutrition is a big part of what we do. We are big providers in wellness, so we've pivoted into wellness so that when patients have a place to go, either start in the wellness, and if they have physical problems that require more physical therapy, one-on-one centric care, we move them in that direction. On the other hand, patients that are done with their physical therapy need to continue a program, and they have the opportunity to go into our wellness program, which includes nutrition, compressive therapy, red light therapy, those type of things, mental health types of activities. So we feel that we have a more of a comprehensive approach, and we're excited about this. If you look at the statistics in the U.S., there's like over the world actually, there's a $6 trillion business in health for wellness. U.S. itself spent over $450 billion last year in this area of wellness, and so we feel like we're a leader in that area, and we feel like we want to put our stamp in there, and I think we are ready for it because we have patients already in our system that would be a benefit staying underneath our umbrella.
Best of luck with all the plans that you have set for the future.
We're ready to go on that.
Now, can you share with us a little bit about your experience at the conference? Did you get the chance to network with the people here?
Wonderful. I've met people from all over the world, so that's a great reason to be here. Fascinating to listen to a lot of the new technology in healthcare, everything from AI transitions to or biometrics for improving patients' health digitally. It's wonderful to see this and also compare our notes. I mean, everyone has a different comparisons of our healthcare systems, and it's wonderful to see. And we're all in the same place. We want to help. We want to help people, and I see that the way it's being. I see everyone's moving into a holistic approach, and I like to see the whole world's doing that right now. So globally, I think we're in the right direction as a team, and this is a world team.
We're glad to know that you're having a good experience here. Now, if anyone would like to get in touch with you personally or find your company, where can they find you?
Our company is at ReLivePhysicalTherapy.com. That's how to get me. My email address is jjudge@ReLiveTherapy.com. So we're in about 12 locations in Chicago and Northwest Indiana, so we do cover the area. It's a third biggest city in the United States, so it's a very busy area, and we feel like we have a great network and a brand, and would like to help people even more with their wellness approach.
Fantastic. Thank you so much, Jim. It's been a pleasure, and congratulations again.
Thank you. Appreciate it. Thank you.